A viral video of doctors discussing the coronavirus pandemic has been removed from social media. Hi, my name is Todd. I want to thank you for tuning back into the Jack channel today. I greatly appreciate you taking time out of your day to come and watch one of my videos. And what I'm discussing is how many of you actually got a chance to watch the group of doctors, which included Dr. Erickson, who had the viral video earlier on about coronavirus, coming together in a forum or a conference and discuss the various details surrounding the global virus pandemic, coronavirus. Because if you didn't get the chance to see it, you might not be able to get it now. It seems to have been banned from all social media platforms: YouTube, Twitter, Facebook. They all seem to be gone. But this was a very important video. It should be viewed by everybody across the United States so that they can make wise decisions and whether or not we should continue to follow the leadership of our country. And one of the things that was brought up was a very long discussion around a certain drug. I won't say the name for potentially having this video removed by YouTube and company, but it was a drug that was pitched by Trump as protection and or a faster recovery should you get the virus. And they discussed it in grand detail on how safe this drug is and how the videos, or excuse me, how the journal articles that came out speaking on how deadly this is, and if you take this drug you're actually going to die from a heart attack. And they discussed those issues and how this drug was approved and has been literally one of the safest drugs put on our market up until our president sings the praises of it. And this drug has been used for multiple things across the country. And here's one more case where the doctors are doing their job and using something that might help and discovering that it actually does help. They get into the discussion that one of the other drugs, remdesivir, was touted by Fauci and others as a quicker recovery with little to no evidence to support the claim. But what they also discussed was how the pharmaceutical company that produces remdesivir was, in a roundabout way, financially responsible for keeping the drug from being put in the hands of people to be used. And so we've got this situation in our country where pharmacists were even refusing to fill the orders by doctors for the drug, and they weren't giving it to the patients that needed it. And the thing is this drug was proven to actually prevent somebody from getting extremely sick. They discussed how the coronavirus has several stages that it goes to, at least 2. And that if you catch it early enough, the outcome will be great. They discussed how this particular virus actually has a very low mortality rate, especially if it's treated earlier on. And there is a valid treatment. This one particular drug mixed with zinc and, if I remember right, a antibacteria medication. The point is, the cocktail, if you would, of these 3 particular drugs would actually prevent you from getting horrendously sick. So It's a shame that when we have medical people who are professionals, who are professionals in their area, you might even consider them expertise at treating the sick and injured, and they're being banned from these platforms because what they say counters the narrative that is being shoved down the throats of the American people. It counters the narrative of the World Health Organization. And as far as I'm concerned, this is sick. It's sick that a medical professional, we're not even talking politics here, we're just talking a medical professional who have been treating these viruses and have had very successful outcomes. They discussed that the issue in our country is the numbers cannot be trusted that we're being told, because the numbers have been skewed. Doctors are being forced to put COVID on death certificates of people who didn't die from COVID, and that those who actually died of other causes than COVID have to label those other causes as a secondary cause, and that COVID should be the first cause. Where they discussed cases of doctors who are being brought before medical boards for even prescribing this drug, and now they're having a legal battle to keep their license. Doctors are being brought before medical boards because they're refusing to label deaths as COVID when they really aren't a death from COVID. So I would say there really is a strong conspiracy in this country that is taking place before the American people, leading the American people astray. It's real similar to the mask requirement that is being shoved down our throats right and left across this country. When the CDC even had on their own website an article that discusses the use of masks and how it doesn't prevent transmission of infection. It's something to think about, but it is really a shame that these doctors' voices cannot continue to be heard and continue to reach the American people because of the censoring of YouTube, Twitter, and our social media platforms like Facebook. It's unbelievable. If you go with the left, your voice gets to be heard. If you counter anything other than what is being spoon-fed and is obvious a lie to the American people. Now, I'm not saying the virus is a lie. I'm saying what they're telling us is a lie. That this really is a virus with a very low mortality rate. Probably less than even the flu at this point. Because you can't believe the numbers of those who have died. I'm not saying there haven't been people that have died from COVID, because there has. But what I'm talking about is the numbers that these doctors were reporting. It's like a 99% recovery if you receive the treatment that is now being banned by our Food and Drug Administration. A treatment that would actually save lives. And our own Food and Drug Administration is banning the sale or the use of this drug from the market. And it's banned from being used. And it is definitely has been proven to be effective in the treatment of COVID and the prevention of death, with a very, very low risk of side effects. And they actually went through who should not take that drug, and my wife would be one of them because of her psoriasis. So the drug's safe. And the doctors are not being allowed to do what they do, and that's practice medicine, because of the government stepping in. And now's the time for the Trump administration to step up and get the stupid bureaucracy known as the Food and Drug Administration to back off and release this back on the market, and to write, I guess, an executive order for the doctors to use it in the treatment, or should we even say emergency treatment, of those who have been tested positive of COVID. And they even went through these tests of positives and discussed some issues, how there have been blank tests sent in, and they've been labeled a positive test. They basically were a sterile swab never put in somebody's nostril, and it came back as positive. But I guess these doctors are the conspiracy theorists, since they've been censored from the social media platforms. And it's a sad day in America when a countering voice cannot be heard, because that's what America was supposed to be. Freedom of speech, where you can counter the narrative being pitched by the government without fear of being silenced, like what takes place in China. And it really does feel like China is in control of the social media now in the United States, with these socialists who have no problem censoring a counter voice or censoring a conservative. So those are my thoughts for the day. Please tell me what you think. Leave your comments in the link down below. I'd love to hear from you. Do your best. Do some research. Track down the videos of these doctors if you can find them. It's definitely a worthwhile watch. Take care. God bless. We'll see you next time. Hi, I want to thank you for taking time out of your day to watch one of my videos. Please hit the like button below, and if you would, hit the subscribe link up here, and take some time to watch one of my other videos. Thanks again, and have a wonderful day. God bless, and take care of yourself.